health diversity and health equity at the Scarborough Health Network. The session today is being recorded, and we look forward to an interactive session near the end of Dr. Murji's presentation. Now, let me start with our land acknowledgement, which is shown on this slide. And in so doing is a recognition that we are on the land that for thousands of years has been the traditional land of the Huron-Wendat and the Petun First Nations, Seneca, and most recently, the Mississaugas of the Credit River. Indeed, today, SickKids, where we're located, and Toronto, is on the home of the indigenous peoples from across Turtle Island. And SickKids is committed to working toward new relationships that include First Nations, Inuit, and Métis peoples. And indeed, we're very grateful for the opportunity to share this land in caring for children and their families. Without further ado, let me turn things over to Dr. Murji. We look forward to your presentation.
Okay, thanks, Dr. Allen. So today we're going to be talking about conversations in vaccine confidence, and we'll talk about the VaxFacts Clinic and lessons we can learn from that, and get into motivational interviewing. So we'll do the what, why, and how about VaxFacts, and then we'll talk about motivational interviewing, and we'll actually get into specific types of vaccine hesitancy and how to approach that, and get to common questions and some interactive portion where we can have some volunteers give it a shot. So what is the VaxFacts Clinic? So it's actually first of its kind in Canada. It's a physician-led COVID-19 vaccine confidence clinic. So you get a chance as a patient to speak with a physician one-to-one. You have about 20 minutes where you are in a confidential judgment-free space. You can ask any questions you'd like. And as you can see, that's what it looks like to book. So it's a very seamless kind of booking module on our website, shn.ca/VaxFacts. And you have your time slot, and you can, people find this very valuable because you have one-on-one time with the doctor and you can ask any questions. We're here to hear your concerns and to address them and make people feel comfortable with the vaccine. And VaxFacts is actually more than the clinic itself. It's actually a movement of vaccine confidence and education. If you're a family physician or a healthcare worker, we're a resource for you. And so we want to really work together and share what we have, so that we're all on the same team here to get everyone vaccinated. So hopefully there'll be some helpful tips in here. In terms of our origin story, as I said, we're from Scarborough, or we originated in Scarborough. And in spring 2021, we were really in crisis. 16 out of 17 postal codes of Scarborough were actually hotspots of COVID. And we know that people who live in Scarborough are more likely to be frontline workers, racialized, and live in multi-generational households, which are often, quite crowded. And so there's a higher likelihood of getting COVID. There's also a higher likelihood of being hesitant about the vaccine. So we knew that we really needed to step up in Scarborough to get people feeling comfortable about the vaccine and to get vaccinated as soon as possible to really put the brakes on COVID spreading in our community. So we started off in Scarborough in about early May, and we had a lot of success. So we actually started scaling out and offering our services to Toronto more broadly, and then to all of Ontario. And then actually very shortly after, we became available for everyone in Canada because this was such a unique service. We offered it to the entire country, and that's where we stand today. So this is what I like to call the VaxFacts Stats. If you direct your eye to the bottom right corner, you're going to see a pretty recent total of our percentages. So we're hovering at around 80% of our callers choosing to get vaccinated after speaking and having a discussion with a physician. So we're pretty proud of that result, and we've seen over 1,000 patients over the course of the past few months. And these are very complex conversations that we're having. And that's what we're going to be discussing today. It's how to have those conversations and have them go well. And then I just mentioned that VaxFacts is more than the clinic, it's actually a movement. So we have community events where we've hosted virtual presentations, town halls, Ask Me Anythings at high schools. We're really trying to get the VaxFacts, or the facts about the vaccine, into every corner of the community. And at this point, across the country. We have community outreach, which is where we have boots on the ground. So we have our partners with local community agencies, religious groups, businesses. We have community ambassadors at U of T, Centennial College. Our medical students at University of Toronto and across Ontario are actually having vaccine confidence conversations with patients. And then also, if they feel necessary, they refer patients to our clinic. So it's all interwoven. And then lastly, we have our social media where we're getting the facts out there. We're trying to connect to a different demographic through our Twitter. And we have a TikTok coming out soon. And that's also another place where our community and Canadians find out about this service that's available for them. So in terms of our method, I think one of the things that makes us unique is the health equity lens that we took in the design of VaxFacts Clinic from the ground up. So the health equity lens is all about removing barriers. So in terms of accessibility, we have hours from 9 a.m. to 8 p.m., 7 days a week, to try to make it accessible for people who might be working 2 jobs, for example. We have a diverse physician group that represents our patient population. As you know, Scarborough is a very diverse community. We have many languages spoken in Scarborough. And so to meet that need, we have, obviously our physicians are multilingual, but we also have over 200 languages of live interpretation services that are available at any time. And then we also removed the requirement of OHIP so that refugees and undocumented people can access our services. And then that also made it really easy for us to scale across the country. And then our second kind of pillar in this way is motivational interviewing and our approach in terms of our clinical approach to our patients. And that's what we're going to spend the rest of the session really going into detail about how this is done and how you can do this successfully. So the purpose of motivational interviewing is that patients have an intrinsic motivation to change, and you want to strengthen that. So everyone has ambivalence about different topics, and we're trying to basically leverage the positive emotions and draw people's attention to the positive aspects about something that they're ambivalent about. So in motivational interviewing, the counselor who is you is acting as a guide, and guiding is taking the best parts of both extremes, where the extremes are listening on one end and instructing on the other end. And you're kind of taking the best parts of both at different times and guiding the patient towards a shared goal. So it really is a partnership. You're sharing expertise and power in the relationship. You have acceptance of the patient's autonomy. You can't be paternalistic because it's not going to work. The patient's going to make the decision. You want to be judgment-free. You want to affirm their strengths. And compassion is about having empathy and understanding where the patient's coming from. And evocation is inviting the patient's views, knowledge, and opinions, respecting that. So that's generally the spirit of motivational interviewing. And there's certain skills that are important and a framework that we like to use. And there's a few different frameworks. This is the one we can use today. So what we can start off with, all the frameworks just have different names, but they're all the same concept. We start off with open-ended questions where you're engaging the patient, you're evoking responses, you're trying to avoid doubts in the patient's mind. So you can ask just, where are you at with the vaccine, and get the patient talking. You can ask the patient, what do you think are the advantages of vaccination? Remember, they have that ambivalence baked in, so it's actually helpful to get them to focus on the positives and actually vocalize that. Affirmations is really, really important. So you want to encourage the patient, validate their concerns, and really highlight their strengths. So you can say, you're really doing your due diligence on this, which is great, or you already have a lot of knowledge. You could also say, you clearly care a lot about the health of your child, and it's great that you're coming to speak with me about this in great detail. Reflective listening and summary. So these demonstrate your understanding and allow the patient to add nuance back to what you just said. So a simple reflection is you saying back what the patient said to you. And a complex reflection is when you're saying what the patient meant. So you can say, so it sounds like you've ensured your parents are vaccinated because you want to make sure that they're protected. But now you're unsure if vaccination is the right choice for you, given that you're healthy and 25 years old. So you're just kind of reflecting back a summary of how you understand their concerns to be, and then they can edit it as they see fit, just to establish that understanding. And then we have our elicit, share, elicit. So this is where you ask, in general, you're asking what the patient knows. You want to listen more than you speak. So you're eliciting. And then when you want to share, you actually are going to ask permission to share. And then when you do share, you only share the things that are relevant. And then when you are finished sharing, you're going to actually ask the patient to kind of confirm what they understood of what you said. And that way you're really closing the loop on the communication. So you can say, like, can I share with you what I know about the vaccines and a little bit more about the science around them? Okay, so just before we get into some specific types of hesitancy, I think it's just important to really get into what our goals actually are in these conversations and resetting our mental frame. So you're actually not trying to get the patient to say yes. It's a bit too goal oriented, and it's going to come across in your conversation as salesy, and it's not going to work. You're actually there to support your patient. This is actually a trust building exercise, as physicians and healthcare workers that we're trying to do here. So you want to really affirm and reaffirm that you are an ally. They need to get that from your communication. You want to validate before any type of persuasion. They're not going to be in the space to hear, why you think the vaccine is important for them to take if they haven't felt heard and understood. And then you're trying to aim for contemplation rather than acceptance. So this is what I was saying about, don't expect to just get a yes. Everyone's at different points along their journey, and we're trying to get people to be at the contemplation stage where they can actually be in a position to possibly accept in the future. It might happen now, but let's not expect that. So, and then just a few more things. Generally, what patients need to hear from you is that them getting vaccinated is their personal choice. That being unsure about the decision to vaccinate is normal, and that you are there for them. That you as a family doctor are a trusted source of information. You've been actually educating yourself about COVID this whole time, and you're committed to sharing information as it emerges. You're a resource, you're a specialist for them, and they hopefully already know who you are and trust you, and you can actually tailor your recommendations to them because you actually are committed to understanding their needs and their belief system and values. And overall, you're actually really there to listen. So it's really important to just have that as your mental frame and understand that that's your spirit when you engage in this conversation. Okay, so let's talk about specific types of vaccine hesitancy. And this is coming from a really great resource, vhguide.ca, which I encourage you to check out after this talk. So some people will have concerns about the science of vaccine. And these are the things you'll hear them say. I don't trust it. I don't know what will come down the road. How's this going to be in 3 to 5 years from now? Will this be yearly vaccine? What about booster shots? I already got COVID. Why do I need the vaccine? So just some tips here, okay? So don't rush into the vaccine, don't rush into the science. Don't just jump into science. People actually want to, you need to listen again, right? You need to understand where your patient's at in terms of their ability to understand stats and data. So you need to gauge that with your conversation. And another kind of interesting point is a lot of people actually they say they want to hear about all of the evidence. And actually, I would encourage you not to jump too deep into all the numbers, because people actually respond a lot better to narratives. And we can talk about what that might look like. Again, ask permission to share about the science before you jump into the facts. And then when you're speaking about these concepts, it's important to break it down into simple and relatable metaphors and explain the vaccine development process and the mechanism of action of the vaccine. That's really where I always come back, is the mechanism of how this vaccine works. That will actually help you answer almost every question that comes your way. So maybe, you might say something like this: you've known me for a fair amount of time, but you might actually not know how much of a science nerd I am. And I'd really love to share with you how these vaccines work and how we got here so quickly, because it's actually a really cool science story. So that kind of builds a bit of trust. Hopefully you have, these are your patients that but you could take a different approach if you're meeting them for the first time. But the point is that you're actually excited to share this with them, and you're offering to share it with them, right? Okay, so this is another type. I'm going to go through a few different types of specific vaccine types of hesitancy. So if they're influenced by rumors, conspiracies, or misinformation, they might say something like this: I don't trust the government telling me what I need to do. They haven't led us down the right road to this day. I don't think pharma companies or big pharma have our best interests in mind. They're all about making profits. Why haven't we been using ivermectin to treat COVID? Okay, so what you want to do here is reaffirm your position as an ally and a trusted provider of health information, because that's what you are. You might want to pose some hypothetical situations or scenarios that would change their mind, that would show them some alternatives to their current views, and then work with the patient to actually identify situations or scenarios that would actually change their mind about the vaccine. Emphasize that you and your perspective as a healthcare worker is different than their perspective as a patient who's not actually interacting with people in a hospital or a clinic. And you can actually find middle ground based off of your shared experiences and understanding. So sometimes what I would say in this case, right, like, I'm not a fan of big pharma either. So everyone, I don't think anyone is actually fully happy with their government. So I think that's like a reasonable concern. So you can say, I'm with you. Big pharma, they obviously do care about making profits. That's kind of our societal structure that we're in with capitalism. Like, there's no denying that. Or you can say, the government might not have actually really earned our trust completely, but me and my training, and I know how to analyze research studies and study and understand science. And I can actually, I've done my own research as an independent expert in healthcare and science and research. So I can explain to you my understanding of this. And you really need to leverage your relationship with the person that you're speaking with, because sure, they might not trust big pharma. They might not trust the government. At the end of the day, people are going to make decisions because they trust you. So you need to really, focus the conversation on that. Okay, next type of hesitancy is religious or moral obligations to the vaccine. So they might say something like, taking the vaccine goes against my religious beliefs. My concern is more of a religious position. Or if it's up to God if I get COVID and whether I die. If I die, I die. It's safer to keep washing your hands, stay away from people, and drink orange juice until the devil's coronavirus work is passed over. Okay, so this one, you might think it's actually really like, when it comes to religion, like you can't do anything. But actually, there is actually a lot that you can say to kind of reframe this understanding. Different people have different like morals. They have actually different palette of their morals and values. And what you can do in this case is actually emphasize that actually taking the vaccination is a moral act. It can be considered an act of neighborly love. You're actually protecting the people around you. You're showing care to others. You can emphasize that the religious authorities, in organized religion, have actually declared the vaccines and the vaccination to be morally acceptable and advisable. So that's around the world. You can consider highlighting that there are shared values between vaccine scientists and the religious community. And you can actually, people want to go back to their mosque or their church or synagogue or place of worship. So you can emphasize that getting vaccinated is actually a key step in getting back to worshiping in person. So I think there's actually a lot of incentives for someone who might say they have a religious objection to getting vaccinated, especially when most religions have officially declared this vaccine safe and acceptable and advisable to take for their followers. Okay, next type. And I think this is particularly important. Negative experiences or trauma from the healthcare system. And we know this is an ongoing issue. So last time I went to XYZ hospital and it didn't go well, and they could have a whole story about that. We know that this exists. Doctors and nurses haven't treated me well in the past when I've needed their help. I get really anxious in hospitals or clinics. I don't know if I can get vaccinated. So the first step here is you really want to acknowledge and affirm the validity of these past personal traumas or social anxiety, these experiences that people had, and that this obviously it makes sense that it affects their willingness to get vaccinated. It's really important to validate that. And then you can ask your patient, what would you need to feel safe getting the vaccine? Hopefully they feel safe with you, right? And hopefully you're taking a culturally safe approach and you're understanding the patient's background and the historical, frame in which we're approaching this. You want to differentiate your role as a vaccine advocate and differentiate that from the larger healthcare or governmental systems, because once you blur the lines, then you're actually lumped into a group that they might not trust. You want them to trust you as an individual and then the insight that you're bringing to this. And then you can also offer to help arrange alternative locations. Like maybe they have specific trauma with this one hospital or clinic. Well, there's other places they can get the vaccine that they might have a blank slate about, or maybe they have positive associations with some place that is designed to be culturally safe. For example, Taibu Community Health Center, where I used to work, was actually designed with the Afro-Caribbean population in mind. And that could be something that you suggest to your patient. Okay, and then there's this group that is completely unconcerned with the pandemic. So they might say, it's being blown out of proportion, it's just a bad flu. I know someone who had it, they didn't get it that bad, they're fine, they didn't even know they had it. Or it's only affecting older people. I'm young, so I should be fine. Okay, so what you can do here is you can emphasize that as a healthcare provider in the community, you have a different perspective of the severity and the impacts of COVID. You're actually seeing what goes down. If they're unconcerned about the pandemic, then they probably are even more upset that they're being locked down because they think that this is for no reason. So you can actually, they probably want to get back to normal ASAP. So you can actually leverage that and talk to them about how many reopening plans are going to be tied to vaccination rates. So the sooner we get vaccinated, the sooner we can all go back to normal, which is what they probably really want. Highlight that the vaccines not only protect the patient, which they might not think is necessary, but it will protect their loved ones and their communities. And they probably, everyone has parents, so they need people can think about their community. This is particularly, important in Canada and in as opposed to some more individualistic societies. So, and then avoid lengthy debates about the facts, stress that that the ease of access and there's a high safety profile of the vaccines. It's not hard to get vaccinated at this point, right? It's not, you can offer to book it for them, or hopefully you can just do it for them, or the resources in your community. So just make it easy for them. Okay, and then just a word about myocarditis, just to show you like a way to kind of deliver something. Sometimes visuals help. So, you know, someone asks about myocarditis, you can explain that it's an inflammation of part of the heart, right? And it is known to have a slight increase in rate of myocarditis after the second dose of the vaccine, particularly in certain populations, which is usually young men age 16 to 30 approximately. We know that it's tied to testosterone as well, which is why it's less common in women or young, you know, kids that are younger than 16 or people that are older than 30. The key here is that, you know, this figure kind of shows it well, is that actually you're a way higher risk of getting myocarditis from COVID itself. So if this is your primary concern, you should still get vaccinated, because as you can see, this figure from the CDC shows that you're 16 times more likely to get myocarditis if you have COVID, and you're going to protect yourself from COVID with the vaccine. So this picture in the bottom left is Josh Archibald. He's the only player on the Edmonton Oilers who did not get vaccinated, and then he got COVID, and then he got myocarditis from COVID. And now you can see Elliot Friedman tweeted that his career is indefinitely over because he has myocarditis, because he got COVID, because he didn't get vaccinated. So, you know, if someone knows about hockey, this is actually a really powerful example. You want to find stories that connect to people. And you can also talk about stories from your own experience as a healthcare provider. You don't want to give away any patient information, but you can just say, you know, kind of the things that you're generally seeing, because that really is powerful to people. Okay, so just some common questions that I hear, and I'll just give you a little bit of how I answer them. So some people say, I'm young and healthy, the absolute risk of dying from COVID is so low, why should I get vaccinated? And again, I would agree with them that that's great that they're young and healthy. Like that does actually lower the risk of dying, okay? However, that doesn't, like, you know, that doesn't equal that they shouldn't get vaccinated, because there's other reasons to get vaccinated. You know, like I'm young and healthy, you know, once again, I would relate it to a narrative, personal thing. So I would say I'm also young and healthy, but I still got vaccinated because the thing that I'm, you know, particularly afraid of is long haul COVID syndrome, where you can get headaches, brain fog, fatigue for months and months, and it might not go away. And we're seeing pretty high percentages, you know, in the 20, 25, 27% of people who have COVID end up with this. That's a really, really high rate. And, you know, we know of people who do triathlons, and, you know, so they're running basically a marathon every time they do a triathlon, and they can't even train with a couple kilometer jog anymore. They're out. We have people who are doing, you know, who are in school, they might be doing their master's degree, and now they've had to take a leave of absence because they're having this brain fog. So really tying it to these like stories makes it really powerful. And then people are like, okay, yeah, you know what? I don't want that to happen to me. I might as well just get vaccinated. It's not really worth it, right, to risk that. So these people, they're saying the risk is so low, but actually the risk of dying might be low, but there's a risk of other things happening too. And then you also, you know, you want to, these people, you can tell them that they're not only protecting themselves from that and long haul COVID, but they're going to protect their loved ones, the people around them, their community, which is also really important to emphasize. Second question, how do we know there won't be long-term side effects? So this is where I would go back to the mechanism of the vaccine. And as I mentioned, you know, we want to break down the science into really simple metaphors. So usually the way I say this is I describe like the path, every step of the vaccine. So, you know, you get the vaccine put into your arm, right, into your muscle, the mRNA goes into your cells, and basically it's an instruction that tells your cells to make this protein called a spike protein. So it starts creating all of these spike proteins, and those spike proteins are the same protein that's found on the outside of the COVID virus. And now your body's producing many, many, many spike proteins, and they're floating around everywhere. And your immune system starts noticing it and says, hey, what the heck is this? It's a foreign thing that I've never seen before. So it develops an immune response. And now you have all these little soldiers that are called antibodies. And they are designed to notice this one spike protein, so that if it ever shows up, they will swarm it. So when the real COVID virus shows up, all those antibodies swarm it, and it cannot as easily infect you. And so that's the mechanism, right? You establish that to be the mechanism. Then you can say, when that mRNA vaccine gets put into your arm, the mRNA, after, it's the set of instructions. After those instructions are read, they are degraded. The mRNA is degraded very quickly in a matter of hours. And the spike proteins that your own body produced are cleared away in a matter of days. You're not left with anything from this vaccine. None of the vaccine is in your body in a matter of days. And the things that are produced from the vaccine are the spike protein, which you clear in a matter of days as well. And then you have antibodies, which you're literally producing right now in response to other things that your immune system has, other challenges that it's experienced. So you're constantly producing antibodies. Your immune system's constantly seeing other viruses producing antibodies. These set of soldiers or antibodies are, amongst millions of others in your army. And there's no reason why this one would cause any problems in the long run, while any of your other antibodies that you currently have are causing it, or not causing any problems either. So there's no difference. There's no reason to think so. And we've never had a vaccine out of any vaccine that's caused any sort of long-term side effect ever. So that's kind of how I would answer that question. And then in the last common question here is the vaccine safe in pregnancy? And there's two kind of approaches to this. One is, I would say, from millions and millions of people who've been vaccinated so far, we know that it is safe. There is no increase in any sort of complications. And we also know that COVID is unsafe in pregnancy. COVID causes very severe complications in pregnancy. It causes an increase in, preterm labor and premature delivery and all kinds of complications associated with that. And then I would also say, even theoretically, if we go back to the mechanism, which is always important to share with the patient, again, there's no reason why the creation of these antibodies, which is something your immune system is doing all the time, would have any effect on pregnancy. Because even if COVID didn't exist, if we go back 5 years, people who are pregnant are creating antibodies because they're normal humans, and that's what happens to humans. They create antibodies. There's no reason why this wouldn't be safe. So that's generally how I would answer these types of questions. Again, this comes after people are generally sharing their concerns and you're validating them and affirming their strengths. All of that is really important. Okay, so this was going to be a practice in pairs section, but because we have a webinar format, we're just going to invite volunteers or a volunteer to come on up and possibly take on a question, just for fun.
Karen, people are hereby invited to raise their hands. Is that the way we would do this?
Correct. If anyone would like to volunteer, please raise your hand and I will promote you to be able to be a panelist and take part of this.
No one willing to step up? Karen, why don't we if we don't have anyone stepping up, I wonder if we could have one of our staff volunteer.
How do you mean?
Ayushi, would you like to be our tester?
I think we're looking for someone to be the healthcare provider.
Yes.
Yeah, and you know, I would be the patient just saying these prompts.
Perhaps Isaac?
Okay.
Yeah, there's no wrong answers here. It's just
There's
we
no
just
wrong
wanna,
answer.
yeah.
Isaac and I are a little bit more informed, and so we might introduce our own biases. So that's why we were wondering.
Yeah.
But let me see if I could invite someone from the participant pool. I wonder if I could, Rosemary, can I invite you to be our tester? Who else can we invite? Deborah? And we also have Kim. What would be some of the key points that you'd want to bring out here, Latif, in terms of trying to get the right message, the right focus of the message here?
Yeah, I think you know, so this, I'm not going to let the government have control over what goes into my body. You can again validate that, you know, they're feeling like controlled, or they're coerced, and that it kind of bothers them because the government hasn't really earned their trust. And just, you know, just take some time to validate that, and then you want to position yourself as an ally to them. So you can say, you know, I'm not doing this because of the government either. My choice was because of my understanding about the vaccine that I independently took, or the research that I independently did. And you can describe, you know, what you understand about the vaccine. You can again offer to share. Well, maybe before you even offer, you can say, you know, let's say that we ignore the government for a second, and you just have this option of doing this. You know, what concerns do you have about this vaccine? Because I think there's going to be other, you know, there's going to be other concerns or fears that are beneath that. And I think that's what is important for you to do, is that you are kind of situating yourself as a third party, so that it's not about the government versus them, because then they're just not going to want to budge. They want to really stand for their autonomy. And you're saying you're actually on their side, and that you're saying that this thing might actually be helpful for them. And let's get into understanding how this works and what could make them feel, you know, apprehensive or otherwise safe with this vaccine. And then you can actually get into the real issues. So that's generally the approach to take with that kind of question.
Okay. Now, Latif, would you make reference to other vaccines or other products that people take in this conversation?
Yeah, so that's a good question. You know, once you're kind of deeper into the conversation and you've established yourself as an ally, you might want to ask them, and it depends. If you're their family doctor, you might already have records on them, and you can find out, like, have they taken other vaccines in the past? You know, what is it about that didn't feel coercive? And really, like, if they can, you know, see, like, there's a bit of cognitive dissonance that you can kind of reveal that's going on. And if they become aware of that, then they can start to align their own actions with their beliefs. Because, you know, the vast majority of people are taking regularly scheduled immunizations, you know, because they're safe and they trust it, and they're not feeling particularly coerced into doing it. Maybe they just normalize it, right? And they trust their healthcare provider. So we want to get them into that same sort of space and understanding that these are decisions they've actually been comfortable with in the past, and that this is just as safe. And this one is particularly important for us to be taking at this time, because the incidence of COVID is just much higher than other infectious diseases that are vaccine preventable in our society at this moment in time.
Oh, that's great. That's great, Latif. I have a few questions, but let's say the second one, Latif. What taking the vaccine goes against my religious beliefs? What are the key elements there that you would try to capture?
Yeah, so we kind of went over this one earlier on. So I'll just quickly go over it because I just wanted someone to practice saying it. But I would go over the fact, I would want to know, tell me about your religious beliefs. Is there like a specific religion that you're part of? And really getting into understanding your patient and saying, I support the fact that you are, taking this, that this is your belief, and that, part of, if you understand, generally the tenets of that religion, basically all religion, is aligned in trying to have a moral obligation for their community and doing service to others. And this could actually be seen as that. And you also want to highlight the fact that, so for example, if they're Muslim, the Canadian Council of Imams has actually said this vaccine is safe and recommended for everyone to be taking, and it's halal. So you can actually cite things like that, or the Pope has said a similar statement. So religious institutions have actually been in support of this vaccine. And a lot of people, it turns out, don't know about that, that are even following these religions. So you can actually just link them to those documents that are pretty easily accessible, and then that will also really help frame their understanding of this vaccine as their moral obligation.
No, that's wonderful. I think the pointing out what the leadership of the religious groups have to say, I think is so key. Now, I did see Tanya's hand up, but it's disappeared. Latif, I have a few types of scenarios, and I wonder if we could just walk through some of those. So for example, I quote someone, I don't see why I should take this vaccine. People like Kyrie Irving, they should know. They don't take the vaccine. Why should I take it?
Yeah. So, Kyrie Irving is, for those who don't know, a professional basketball player. So I think that you got to be a little bit careful here. You got to see what you know about your patient, right? Like Kyrie Irving is also someone who has publicly said many times that the earth is flat. So you got to also be careful, right? You don't want to appear like you're aggressive and you're invalidating someone. It just depends on, you could actually just say that one of the ways to do it is actually just questioning the source, right? Like, who are you going to trust about a vaccine, about a medical, like a concept that is very scientific? Are you going to use Kyrie Irving as your like benchmark or your role model or your source of trusted information about this, complicated scientific concept? Or are you going to trust your doctor that you have a relationship with, people that have years and years and years of training and understanding science and understanding research studies? And then you can ask them, like, who do you trust and why? And I think, again, there'll be a bit of cognitive dissonance with that. And if you do that in a respectful way, like you're not challenging them, you're just gently kind of showing people that, that we want to really think about who we're trusting and what information they're sharing and where it's coming from and where it's originally coming from. And that would be probably the way I would go with that. But you got to be really gentle and careful.
Oh, that's wonderful. Thank you. Now, Tanya, you wanted to have some more interactive discussion with Latif?
Yeah, I just had two questions. One thing, I'm sorry if I missed it, but one of the things that I've seen come up is the ingredients in the vaccine. Like it has stem cells in it, it has pork in it, it has like different things that I've heard about that. So how do you address that? Like, I know it's pretty straightforward, but there's a lot of misconceptions on what's in the vaccine. And the other piece, I wonder if it makes a difference, just thinking about globally, right? Like the fact that we are lucky in Canada to have a vaccine. There's countries that, people don't even have access to the vaccine. Is that a line of thinking that is actually fruitful for people who are on the cusp, or it really doesn't make a difference?
Yeah, thanks, Tanya. Yeah, I actually do use that. So I'll start with your second question first. I do say that sometimes, right? Like today, I'm not able to give you every line I say. I'm just generally giving you some approaches, but yeah, that is something that I do find is sometimes helpful when you're positioning and framing, the fact that we're getting vaccinated. You can also, what you want to come across is authentic and genuine. So for example, I think that there are some valid ethical concerns with all of us getting third shots when most of the world has not gotten their first shot. And I think that you can actually just mention that, but then at the same time saying how it's very important that we all get fully vaccinated, which is our first 2 shots, because it really positions you as someone who's genuine and not just blindly following every statement. Like at the end of the day, I still got my 3rd shot because I'm high risk, and I'd still want my parents to and my family to, but it just shows that you're actually thinking critically about things. And once again, in the same vein, taking it back to your question, Tanya, is that yes, we are actually super privileged to be living in Canada and having access to the vaccine, and so many other people don't. So that is actually, you can bake that into some of your responses. Going back to your first question about the ingredients in the vaccine, yeah, there are no stem cells in the vaccine. There is no pork. You can get an official list, and I offer to share that with my patients anytime this comes up. And you can go over, what's in the vaccine. Like really, it's just mRNA, which is a type of, instruction kind of genetic material that is, it can't affect your DNA, and you can talk about that if that becomes something that they're concerned about. And then there's just like some salts, sugars, and fats, all stuff that is just used to hold the vaccine together so it can get into your cell so that the mRNA can actually do its job. And then it's just all cleared from your body very quickly. Nothing really stays in your body in the long run. So yeah, I would just show them the list and just be very frank with them.
So Latif, and I agree with you 100%. Somebody comes here and they now say, yeah, I see, I get it. That's what they tell us. That's in the vaccine. How do I know that they don't have hidden stuff that they haven't told us? How have you come across that type of a question?
I haven't personally come across that one specifically yet. But what I would do is, again, it depends on your relationship with the patient. But like the fact that you yourself have been vaccinated is actually a powerful concept. You're like, I trust that this is what it is. You can talk about how Health Canada has really strong safety requirements, right? You've chosen to get this vaccine. You are, you can talk, again, narratives are important, right? So even though this is anecdotal, you can talk about how I had a sore arm the first time and I had a little bit of a headache the next time. I have not had any other symptoms. I've not gotten COVID. I feel great. It's been over a year since I've gotten vaccinated. You can talk about that. You can talk about how, the same thing with millions and millions of other Canadians and Americans and people around the world. There's such a huge amount of people who've been vaccinated now, and we're seeing how they're doing really well. So, you believe that there is nothing else in the vaccine. At the end of the day, you have to trust someone, and you're asking them to trust you because you are the expert in this field.
Yeah, absolutely, absolutely. Another, again, along the same theme, not a Kyrie Irving type of scenario, but well, I heard that on the internet that, you know, the president of such and such a country, blah, 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 says that, you know, he doesn't believe in the vaccine.
Yeah. So that actually happened in Tanzania, which is where my dad is from. And I've lived there in the past. And there was actually, you know, really significant poor health outcomes that kind of occurred because of that type of view. So I would actually just bring it back to like, okay, that happened. It was actually very unfortunate. That is an anomaly in terms of world leadership having a view like that. And we can actually see like what happened in terms of COVID in that country. And then look at the countries that are, you know, that are actually getting vaccinated and what's going on in those countries, right? If you're someone who believes, like basically you just want to connect people to the idea that there are trusted people and like, you know, healthcare providers. Like, I think we want to get away from the idea of governments because people generally don't trust governments. People don't trust politicians. So take it back to you as a healthcare provider and the choice that you made and the research that went into informing your choice, that you actually have years and years and years of training. You've looked at the research and the data. You've made the decision to take the vaccine yourself and for your family, and you're doing okay. And you care about your person, the patient in front of you, and that you recommend they also get vaccinated, and you know why that would be a good choice for them.
No, that's great. Latif, and I also invite my colleague Isaac to chip in if he has any scenarios. But let me throw another couple at you, Latif. So yeah, you can vaccinate me, but I don't really want you to vaccinate my child because I don't think you know, we have enough on these vaccines. They were developed too quickly.
Yeah. So the vaccine from, you know, if anything, you know, this person has chosen to get vaccinated. They're now not choosing to vaccinate their child. The vaccines from the patient and their child are almost identical, right? There's just like one like stabilizing component added and the dose is being lowered because children's immune systems are so much more robust that they can actually mount a equivalent antibody response. So, you know, we actually have tested this vaccine. We've tested it for for months and months before it was even unveiled, which was over a year ago now, right? So we started testing in April 2020, which is like almost 2 years ago at this point. There's actually a lot of data from those from the people involved in those tests, plus, you know, vaccinating half of the world so far. So we actually know a lot about the vaccine. In terms of the children's vaccine specifically, there were also tests done on children. And then again, there's no reason why children wouldn't respond well. We know how vaccines work. We have years and years of testing vaccines in general. So there's just a lot of ways to kind of answer this question. But at the end of the day, I would really try to spend some time to first, again, validate the patients, understand really what their concerns are. If it's about the speed, I'm not sure about if that, like, I would kind of dive deeper into that because they've already chosen to get vaccinated, right? So there's a little bit of an inconsistency under that. And I would just gently explore that with the patient.
No, that's really wonderful. Now, before going to my colleague Isaac, Tanya, you have another question?
Yeah, sorry, I know we're in the early days, but I'm curious to see, has anybody, because the early indicators the way the news media is saying is that the new variant could be potentially vaccine resistant. So I'm wondering, has anybody actually mentioned, well, if it's vaccine resistant, why am I getting my vaccine? Type of thinking. So I'm just wondering if that's come up.
Yeah. So yeah, this just in the past couple of days, right? With the newest variant, Omicron, and people are starting to just wonder about that. It's still important to get vaccinated because there's still other strains of COVID out there, first of all. And just because this vaccine, so first of all, we do not know if the vaccine is going to be effective against Omicron. It very well could be. There is almost no, like the risks of getting vaccinated are so much smaller than the risks of not getting vaccinated. So the benefits far outweigh the risks. You're protecting yourself against all the other strains that we know of that it works against, plus potentially Omicron as well. So I wouldn't say that is a good reason to not get vaccinated or defer vaccination, because before you know it, you're going to have Omicron and you're going to wish that you had the vaccine.
No, absolutely. So Latif, there's a question that relates to, and I see this a lot where people will say, well, I live in an area of Ontario where we have 1 case of COVID, 2 cases of COVID. Why should I get vaccinated?
Yeah, that's a great question, and this is very common in rural areas.
Yeah,
and I often work in Northern Ontario and have encountered this. And the thing is that these communities actually, every once in a while, they have outbreaks, especially in schools, and kids bring it home, and then everyone wants to get vaccinated. And you can actually tell them about that. You can say, yeah, you might be having 1 case in the community every month right now, and that's good that your cases are really low. But it's gonna, once you have your outbreak, that's when everyone's gonna wish they got vaccinated, and it's gonna be too late at that point. You already have COVID. So this is you being proactive, and this is a step in preventative healthcare, and you can take this now, and the benefits far outweigh the risks. And then you can offer to really understand what might be their concerns about the vaccine itself, and really, gently explore that with them.
wonderful. Isaac, quick question.
No, just a quick comment. I think, Latif, I think that was great. One point I wanted to bring out is that sometimes people lose a sense of proportionality, because 2 people in a lowly populated area might actually represent a high percentage compared to a large area. And we don't tend to think that way. Sometimes one needs to draw the attention to that.
No, that's a really good point. That's a really good point. Now, there was a question in the chat about the scenario where someone has a complex underlying disease like heart disease, and trying to address getting vaccinated versus not. Do you want to just quickly address that scenario, Latif? Underlying medical issues.
For sure. So that's one of the most common calls that we get at the VaxFacts Clinic, is about people's underlying medical conditions, the medications they take, or allergies they might have. First of all, I would say that we are happy to take any of those consultations at the VaxFacts Clinic, and you can make an appointment at shn.ca/VaxFacts, VaxFacts. Secondly, there are very few contraindications for this vaccine. So in general, it would be safe. Unless they already had myocarditis from the first dose of the vaccine, or they have a very serious like anaphylactic allergy to polyethylene glycol, PEG. Those are the only 2 absolute contraindications. Usually patients who have these concerns haven't spoken with their specialist specifically about it. And we can actually take those consultations at the VaxFacts Clinic, or you can feel free to see them and connect them with their specialist so that they have the peace of mind. But either way, usually the play would be for them to get vaccinated, and it would be safe for them.
Wonderful. Latif, that brings us to the end of a wonderful session. Thank you so much. This is really, really great. We really appreciate you sharing your experience with us. There's information on VaxFacts. And of course, please remember to complete the evaluations, and Karen will be sending you a link in that regard. So without further ado, again, Latif, thank you so much. And I want to thank all the people who have worked with you to make this wonderful initiative worthwhile. So thank you so much. Have a great
Thanks,
afternoon.
everyone.
Take
Okay.
care. Bye-bye.